Today we are talking about uterine cancer in women. Uterine cancer is the cancer which begins in the internal lining of the uterus, that is the endometrium. Usually, endometrium is shed off during the menstruation, and after the menopause, there is no menstruation, so there is no shedding of the uterus. But whenever the cancer develops in this lining of the endometrium, is known as uterine cancer. Obesity, certain lifestyle diseases like diabetes, hypertension, those women who are taking the hormone replacement therapy for a longer time, especially in the unsupervised way. Those women who had the breast cancer and had been treating tamoxifen for the longer time, they are at increased risk of the developing uterine cancer. Other than this, there are familial risk factors like history of the uterine cancer in the family or the colon cancer in the family. There is increased risk of developing uterine cancer. Those women who have their menarche in early age and those who have the delayed menopause beyond 52 years. Seen usually is the postmenopausal vaginal bleeding or spotting, because this is the disease of the postmenopausal age group of the women, but the younger women also develop the uterine cancer. So when the cancer occurs in the younger women, we usually see the symptoms of the irregular and the excessive vaginal bleeding. So whenever these symptoms are there, I think the women are likely to consider to exclude the uterine cancer. I think I would like to tell that we know that this is the disease which is related to the lifestyle. Increase in the incidence of the obesity and the lifestyle diseases, as I said, diabetes and hypertension. So if they maintain the healthy weight, do proper physical exercises, and definitely they can control their diet to balanced diet, not having the junk food, and definitely good leafy vegetables, fruits and vegetables, depending upon whatever they can consume. They can have the regular health checkups. What is important is that in its very early stage, when the patient is not having the symptoms, slight thickening in the endometrium can be picked up on the regular health checkup, just transvaginal ultrasound. So we can prevent this disease by reducing these risk factors. We can diagnose it early with that of the regular health checks. And what is important is that women should not have the infertility. That's another risk factor. So they should get married in time and having the pregnancy as well as the lactation. So that's how they're changing in the lifestyle definitely is going to make a difference in reducing the risk of uterine cancer. But when it is diagnosed, it is important that these patients are treated by the specialist of the Gynae Oncology so that we can deliver them best so far as the quality of life is concerned, as well as the best survival.